Hey, Dr. John. Recently, we've had a number of clients who have suffered a TFCC injury. Are you familiar with those?
Yes, Mark. I'm familiar with TFCC injuries, otherwise known as triangular fibrocartilage complex injuries.
Are TFCC injuries serious?
Yes, Mark. TFCC injuries can be very serious.
Are you qualified to talk about TFCC injuries?
Yes, Mark. I've evaluated and treated TFCC injuries.
Can you help us understand the relevant anatomy that would help us understand the TFCC injury?
In order to understand the TFCC injury, let's take a look at this next slide, which shows the anatomy. What we're looking at here on the top first is the hand overlaid with the carpal bones, the metacarpals, the radius, and the ulna. On the right side of that diagram, you can see there's kind of an orange structure, and that represents the triangular fibrocartilage. If we then take a look at the square piece that's been outlined and magnify that, we can see even closer where the triangular fibrocartilage attaches to the primarily to the ulna and the ulnar side of the carpal bones.
What's the function of the TFCC?
TFCC is primarily involved in helping with attachments of the ulna to the carpal bones. The triangular fibrocartilage can also provide some shock absorption in the wrist.
If our clients suffer a TFCC injury, what kinds of symptoms should they expect to experience?
TFCC injury can typically result in pain primarily at the ulnar side of the wrist. But depending on the size and the location of the tear, you can also get clicking, locking, catching, and those are all areas where the TFC has been torn.
How do these TFCC injuries occur?
TFCC injuries occur primarily through a slip and fall or a fall onto an outstretched hand. When you take a fall, if there's compression that occurs at the triangular fibrocartilage, that's how a tear can occur.
How are these TFCC injuries diagnosed?
So TFCC injuries are diagnosed primarily through a history, physical examination, and because x-rays are only good for looking at bone, typically an MRI, which can show the ligaments and the triangular fibrocartilage better, are used.
Who are the right providers to diagnose or treat a TFCC injury?
The medical providers who typically treat and diagnose these types of injuries are orthopedic surgeons.
What kinds of treatment can our clients who suffer TFCC injuries expect to undergo?
Treatment for TFCC injuries often requires surgical intervention. The type of surgical intervention is dependent on a number of factors. The first factor is the location of the tear. When the tear is located inside the wrist, usually in an area that won't heal on its own, wrist arthroscopy or placing a camera inside the wrist is primarily done. When the camera gets placed inside the wrist, the tear is located and it can either be debrided, which means clean up the edges of it, or it can be repaired, where a suture is used to put the edges back together.
Based on the anatomy of some patients, are they more vulnerable to suffer a more serious TFCC injury than others?
In some patients who have a certain type of wrist, they are more vulnerable to sustaining TFCC injuries. If we take a look at the next slide, we can understand why some patients are more vulnerable to TFCC injuries. What we're looking at here are the bones of the wrist. On the left side of these three images is the radius, and on the right side is something called the ulna, so the radius and ulna of the wrist, two bones of the forearm. When the radius is at the same level as the ulna, it's called ulnar neutral, and we can see that through the middle aspect of the diagram, where there's an imaginary line, dashed line that connects the radius and ulna and puts them at the same level. When the ulna is lower than the radius, that's called ulnar negative. When the ulna is higher than the radius, that's called ulnar positive. We're most concerned with ulnar positive variances, and the reason is because an ulnar positive variance puts increased pressure on the TFCC. So when a patient who has an ulnar positive variance sustains a fall on their wrist, that can increase the pressure inside the area where the TFCC is located.
When our clients are ulna positive and they suffer a TFCC injury, what types of treatments can you expect that they'll need?
So after treating the triangular fibrocartilage tear with first the arthroscopy, the second part of the surgery is to address the ulnar positive aspect of the wrist. If we take a look at this next slide, we can see in this area, the imaginary line that connects with the radius and ulna, the ulna is actually higher than the radius. In this case, that's the ulnar positive wrist. So what happens next is in the next slide. The treatment requires the ulna to be lowered. And in order to do that, another incision is made under the ulna. The ulna is actually broken, a part of the bone is taken out, and the ulna is then repaired again with a plate. You can see here with the plates and screws. And ultimately what happens is the radius now, or the ulna, has less pressure in the area where the triangular fiber cartilage tear was sustained.
When our clients have gone ahead and suffered a TFCC injury and undergone treatment, what does the future hold for them? What can they expect to experience in the future?
Expectations after sustaining a triangular fiber cartilage tear really depend on the severity of the tear and whether you have an ulnar positive or ulnar negative variance. In patients who have just a simple tear that can be repaired or cleaned up pretty easily, normal function can be anticipated. But in those patients who had a more severe tear with an ulnar positive variance that requires more extensive surgery, sometimes longer term effects can occur.
Thank you, Dr. John.
You're welcome, Mark.